In the hallway who wants to join us, we're going to get started. Our next speaker is a neurodevelopmentalist. She has been working with children with special needs since she was 18 years old. We had the luxury of having her as Lydia's therapist for a year. And out of all the people that we've worked with, and many therapists, we chose to ask Alison to come to speak today because in addition to her excellent intelligence and knowledge, she also has a huge heart, is very intuitive, understands special needs, and can really, really, really help make progress with our children. So it's my pleasure to introduce Alison Wimmer.
Thank you, sweetheart. Hi. I have, as she said, been working with children with special needs my entire life. I spent my high school years... I'm going to get you. I spent my high school years hanging out with kids that I think you guys are raising right now. I wasn't popular, but neither were they. So we had a connection, and we hung out. And recently I had a chance to join those children when I suffered my own brain injury. And I got to rehabilitate myself and learn firsthand what you all are going through. No, I don't have Down syndrome. But I've had a stroke. I've had a heart attack. I've had MRSA in the lining of my brain. They gave me a day and a half to live. I wasn't symptomatic. I didn't have a fever. I had goo coming out of my ear. I had so much goo that none of the antibiotics that I took would touch it. All they did was made me shake, itch, cough, not be able to breathe, have diarrhea, vomit, and not be able to sleep. The MRSA got so bad that when I finally went to the doctor and said, I know it doesn't look like I have an ear infection, but I feel like I'm dying. Could you please take a sample of this goo so that you guys can help me to live, because I don't think I'm going to live. He wouldn't take the sample because the guy only came on Tuesdays and Thursdays, and it was Monday. And I was in Long Beach, California with my daughter, who was 15 years old at the time, and she was a singer. And so I had taken 6 months in California, and we were just doing homeschool. She's a bright little girl, and I thought, let's have the experience. Let's have the mother and daughter time. And I got sick. So I took a cotton swab. It looked like one that they would do a pelvic exam with. I put it in my ear, and I drove with my GPS to all the labs in the Long Beach area. And I was told by the majority of the doctors and people at the desk that this was really unusual and they were going to have to call security. I needed to get myself and my swab out of the building. Okay? Finally, I found a gentleman at his car that had a briefcase and a lab coat, and took a little longer than he probably should have to get in his car. It was pouring rain, by the way. And I had driven there holding my head up because by this point I couldn't hold my head up on its own. I had left my daughter behind because I was afraid that I was too sick to actually drive and make it the 1.5-hour drive to Long Beach to see the doctor. When I finally got in and I gave the swab to someone, he took it and eventually lost it. That swab was gone. I went back to the doctor the following day, and it was Tuesday, so he took the swab and he sent it into the lab. The lab then took the swab, tested it, and by the time I got back to the CVS pharmacy, I was standing in the pharmacy, and there was a line of people all with their little masks on because the swine flu was very prevalent in the area. So they were all there with their little masks on, and here I was sitting holding my head up because I didn't have enough strength to sit or hold my head up. And the pharmacist called me over and said, "You're going to need to go over there." And I said, "What's up?" He cleared the pharmacy, and I was told I had MRSA. And I needed to speak with my daughter immediately. He was on the telephone. Long story short, I went into Cedars-Sinai Hospital. I had to let the treatment that they gave me, that they hoped would work, take effect for about 12 hours before I could go in for surgery. I wasn't allowed to enter the hospital through the regular doors because of the swine flu. They thought I would die if I got the bug. When I got in there, my husband dropped me off. I think he was grateful to be away from me for a few minutes. And an anesthesiologist said that she would refuse to operate because I was so toxic. She had never operated on someone as toxic as I was. She had someone come in, they gave me my last rites. It's the last thing I remember. So that was a traumatic experience. They drilled out, they took my ear off, folded it to the side, drilled my ear out, did a mastoidectomy, which is a really cool procedure if you're healthy when they do it. They took the bone out from behind my ear and a little bit up here and put a lot of stuff in my brain around the dura lining of my brain because they found that my brain was becoming infected with MRSA. Now, if you guys don't know what MRSA is, it's a medicine-resistant strain of strep. Okay, 4 years ago it was deadly. Everybody has it, but for some reason it got in my brain and it stayed there and it was bad. Okay, I tell you all of this because you have to understand that it's scary. It's scary when people get into your brain. I didn't have support. My neighbor had never had MRSA. Everybody thought I was going to infect them. It was the scariest thing I'd ever experienced. But what saved my life is I knew that something was wrong with my brain. And 3 weeks after the surgery, when I all of a sudden got sick again, and they told me I was a baby. Alison, you just had major brain surgery. You know, we went in there, we tore your head apart. Of course you're going to be in pain. Of course you're going to be dizzy. Of course you're not going to be functioning right. And I said, no, I was good. 5 days after the surgery, I felt really, really good. You don't understand. I'm sick. I'm dying. No, Alison, you're not. You're fine. I flew back here, went to see my regular doctor, and told him, I need an MRI. I'll pay cash. I want to go now. And I went, and they did an MRI, and they scheduled the surgery for 4 days later. I, in fact, did have MRSA again. It had infected the lining of my brain again. The treatment that they had done did not work. It was now in my temporal bone. It was bad news. So I went in for surgery. Again, I had prepared my will and, told my children everything I ever wanted to know. It was tough. But the bottom line is they went in and they did the surgery, and fortunately they did, because there was a huge mass on my brain that wasn't there 4 days earlier. I call it a snot ball, just because I hated it that much. And it oozed its way into my brain, so they had to cut this thing out of my head. And because of that, I have no hearing in my left ear. I have no balance with my eyes closed. I slur my speech, which I did after my stroke anyway, so hooray, I'll fix that again. And I have aphasia, which means I forget words. So the whole reason I just told you that story is because if I forget a word, will you just be patient? And I'll come up with it, and I'll help you guys through this so that you can understand what it means to be a neurodevelopmentalist and how I can help your children. Here we go. My mouse is not working. Okay, so we are presented with a challenge when our child is diagnosed with Down syndrome. The doctors tell us your child has low tone, they'll have problems with eating, they'll be heavy, they won't have friends, whatever they tell you. They tell you the issues, they give you the diagnosis, they tell you the outcome, but they don't tell you how to fix it. You go through periods of acceptance, sadness, fright, flight. fight with your spouse. You are in denial. You go internal and don't function well with others. Then comes understanding. You start to look on the internet, you talk to other people, you talk to your pediatrician, you see children at the mall, you stop the mothers, you talk with them, and you learn more about Down syndrome. And as you learn, you begin to, again, accept and understand. However, there's so much stuff out there on the internet that at times, even when I'm looking and doing research for a client, there's stuff on that internet that scares me. You know, you're at the mercy of the author that wrote that information. And sometimes that information is just wrong. You need to be really careful. You know, people can claim anything. So when you're reading something, check its validity. Talk to your doctor. Talk to your friends. Join a listserv. Run it past a lot of people. Be careful what you read and what you do because of what you read. The biggest challenge out there is the public's perception. Okay, I see that every day. I'm just a neurodevelopmentalist. I'm not a doctor. How do you believe what I tell you? How do you do what I say because I said? It's difficult. You know, how can you be the teacher to your child? Because that's what I want. I want you guys to teach your child because you guys love your child. You love your child unconditionally, and there is nobody out there that loves your child more than you do. So when somebody is assigned to work with a child, I want the parent. And sometimes the parent isn't the best teacher, but they often know who will be. You know your child best, and you can do anything if you set your mind to it. Some of the things that I work with families, you know, and especially with my own history and the history that I gave you when I first got up here, is are they symptomatic? You know, is there an issue with them with tonsils? Do they have a lot of colds? Do they have sinus congestion? Do they have diarrhea? You know, tummy pain, teething pain, ear pain? You know, look at the symptoms, because the symptoms tell you what's wrong. And you can look at those symptoms and then go back to the root cause of the issue. You know, how can you get rid of ear issues? Well, the first thing I would recommend is look at the diet. You know, is that child drinking a lot of milk or eating a lot of milk products or soy? Is the child not drinking enough water? Are they swimming in the pool a lot and their ears aren't clearing? Is there something that you can do to help the symptom? There's always, you know, I always say to go with the smallest kind of intervention possible first and see if that works. Does a child have a typical pain response? You know, do they know when they're hungry? Can they tell when they have to potty? When they bump themselves, do they respond properly? Those are all things that tell you if a pain response is proper or not. With me, with my ear, I didn't have any pain. Why? Well, because I had a stroke. No one is the same. Doctors wouldn't treat me till I was almost dead because I wasn't typical. You need to be an advocate for your child. You need to stand up. I was an advocate for myself, but by the time I got so sick, they just thought I was on drugs because I could barely talk. Be an advocate. Stand up. If you can't do it, get someone else to do it for you. Have somebody stand by your side and say, you are not listening. She is telling you her child has this or that. Talk to the teachers at school. If they say, no, you can't pull Jimmy out until 11 o'clock in the morning. You know, he needs to be in school. This is where he's going to be taught. Stand up and say, well, Jimmy's the best in the morning. I'm going to work with Jimmy for a couple hours and then bring him into school. Be an advocate for your child. You know what's best. Trust your intuition. Without intuition, that little thing that we hear inside of our ears, and I think men have it too, but I'm not sure. You have to trust that. Okay? If you think it, if it's even just for an inkling, check it out, guys. There's something to be said about intuition. Remember that doctors work for you. I fired Mr. W. The last part of his name is Itaker. Because he called me a baby. I'm not a baby. I had a stroke. I had a stroke in the ER at Scottsdale Osborne at 32 years old. I weighed 120 pounds. I exercised 7 days a week and ate vegetables, didn't drink or smoke. And I had a stroke. I fired Mr. W, Dr. W, because he wouldn't operate on me again. And guess what? If he didn't operate on me again, and I didn't have that operation, I'd be dead right now. Confirmed. Guaranteed. They told me. I saw it. I know. The doctors work for you. They don't say what you do and you got to do it, or else. If you don't like what you hear, leave. I always like my kids to check, the parents of my kids, to check their ears, their throat, and their teeth. I used to work with a great organization called NACD, and the founder, Bob Doman, is actually quite a good friend. He's a remarkable man, really smart, really logical, concise, strict, straightforward, to the point, and on the ball. Okay? He taught me those things. He said, Alison, if a kid's having a seizure or they're not acting right or they're starting to stim or there's a big regression, I want you to look at the ears, the throat, and the teeth. Recently, I left NACD in the midst of all this that was going on with me and have just started back up with my work. A few months ago, back in November, I started with a young man named Artie. And Artie has autism. He lives 8 minutes away from me, and he's a really cool dude. He's 24, adorable, and we hang out a couple times a week. Artie has seizures that are so bad that he stops breathing. And it really freaks his mom out. I mean, it freaks me out too. If I see him about ready to have a seizure, I generally will stop working and we'll just kind of sit there and wait. And sure enough, he'll have a seizure. Recently, I had Mom make an appointment with the dentist, and after his second seizure, and the dentist took a little while because, of course, Artie's special needs, and he had to be put out, and not every dentist is willing or able to treat him. He had 8 cavities in his mouth, and he hasn't had a seizure since those were treated. Fluke? Who knows? But if that's the case, I'd rather go to the dentist than the ER. You really are what you eat. With me, if I eat pizza, bread, noodles, milk, I know how I feel. I kind of feel slumpy and tired and yuck. Okay? Look at your kids. What are you putting in their mouths? Are they having sugar? Okay, sugar's not a bad thing, but what's good about it? Tastes good. It's fun. Put on all kinds of wrappings and cool little, lollipops and all these great things, but there really is no value to sugar. Limit it. There's a lot of special things out there that you can use that are natural, that are sweeteners. Look at carbs. Carbs turn to sugar. Okay? Spaghetti, pastas, all of those things. If you have a kid that has yeast issues, okay, yeast attacks the brain. You really want to look at the sugars and the carbs, and you want to reduce those, eliminate what you can, and look at things with more value. Dairy. Dairy's gigantic. We grew up thinking, cow milk is really important, but honestly, cow milk is for cows, guys. It's for baby cows. That's why we have milk, for baby cows. The closest thing that we can feed our children to mother's milk is goat milk. I always thought of goats as really gross animals that eat garbage because I used to have one when I was 4. And I know he ate garbage. But the thing is the milk that comes from the cows that are fed well is really, really good for our children. So if any of you out here have infants that are bottle fed, or even young toddlers that could handle goat milk, I suggest that you get started with that right away. Sometimes it's hard when our children are older because the taste of it is not as good as what they're used to. So I suggest that you take a little bit of goat milk, put it in a container with whatever milk they're drinking, and gradually increase the amount of the goat milk. Stay away from cow's milk and soy milk. Our little guys, the ears are set lower, so that your station tubes are like this instead of like this. So if we thicken that mucus, it's going to be even harder to get out, and it's really hard to drain a pipe if it sits like this. Make sure you're giving them enough protein. Protein is like gas. It's like fueling your car. I eat protein every 2 hours. Why? Because if I don't have it, I get shaky, emotional, a little off. If I put a little protein, like 8 walnuts, 8 almonds, a handful of pistachios, whatever I can find, a scoop of peanut butter even, I feel a whole lot better. Protein is excellent. It's an excellent source of fuel. I would suggest, though, not giving your child protein after dinner because it can keep them awake. The body will stay awake to digest that protein. If your child has cravings, look at those cravings. Are they craving something that after they eat it, they're a little manic? They don't function as well? Sometimes we crave things that are sensitivities to us, things that actually are not good for us to eat. So look at their diet. My daughter, typical, her name is Zoe, she has a sensitivity to corn. To this day, if it's got corn in it, she'll eat it all day long. And then she's a huge grump. Okay? If she doesn't have corn and I point out to her not to have it, she does feel different. Same with ice cream. Okay? She's typical. We can talk about it. Doesn't stop her from eating it. But she knows she's going to be a grump. Sensitivities are hard, but there's so many alternatives out there. My oldest son was allergic to everything. And I was able to find him fake cheese that looked just like the sliced cheese I could get at the grocery store that was made out of vegetables. And I made him homemade pizza with that. Was it harder? Yeah. I mean, we had to bring our own food. And, I heard Jane talk this morning about bringing our own ice cream to the ice cream store. Those things, there's just accommodations. But it's so important that your child feel good and that they have the right things to eat. And they are available. I mean, I had a gluten-free granola bar this morning, and man, it was good. She said, "Do you mind if it's gluten-free?" And I'm like, "No, thanks. It's awesome. Tasted really, really good. Great alternatives out there." You want to look at your expectations. My husband, Matt, is a special ed teacher, and he teaches children who are from kindergarten to grade 6. Generally, they are the more impaired children, as the school calls them. They are less likely to go into the regular classroom daily, and he works with them. A lot of their IEPs angered him initially to learn 10 sight words in a year, for instance. Learn the numbers 1 through 10 in first grade. Hello? We can teach our kids these things in a week. How? Input, guys. Focus. You want your child to learn to read the word mom? Show it to them. Show it to them a lot with high excitement, great intensity, lots of variations. They'll learn it. If you take a child with a developmental delay and you span what they need to learn over a period of a year, and they don't meet those goals, they are never going to catch up. But if you take whatever you want to teach them and you teach it to them face on, high intensity, high frequency with a lot of good energy, they're going to learn it, and they're going to learn it fast. If they don't learn it, there's an issue with something. You've skipped a step, or you've done something, you're I'm going to show you, okay? Pretend these are cards. In fact, let's use these. So I've got some sight words here, okay? I want to teach mom and brother and pool and candy or whatever, okay? I've got a bunch of words. First of all my words are going to look different. Why? Because a child takes a picture of that word card, okay? They don't see it as separate letters. They take a picture. So I don't want to put mom and dad because they're all 3 letters and they're M-O-M and D-A-D, and I just think that's too similar. I might do hippopotamus and mom, or candy and pool, because they look really different. It's important that that picture be different. I don't know if you guys ever read the People magazine, but one of the things that drives me absolutely crazy is in the back they have 2 photos that look identical. And you look at those pictures, they look so similar you can't see the difference in those pictures. So think about that when you're making word cards for your child. I take those words, I write them, and I turn them upside down. Okay? So I've got the word mom, and it's upside down on my word card. All right? I'm going to hold it towards me so that the child sees only blank on this side. And I'm going to flash that word mom to them. Again, they don't see a word here. I'm not showing them like this and showing them mom so that they're reading the next word and thinking that's mom when it's not. That's candy. Okay? So I've got it upside down, and I'm going to flash this card really, really quickly and with a lot of movement and high intensity. Okay? Mom! Mom! Touch mom! Where's mom? Okay? Put it out in front and have them slap that card. Give them lots of good input. All right? And go through your cards maybe 3 to 5 at a time, getting them to be sure that they've seen that card when you're inputting that information. Okay? There are ways that we can get sight words, letters, numbers, math facts into our children by using high intensity and movement. There is nothing worse than holding a card in front of a child and saying, 3 plus 5 is 8. 3 plus 5 is 8. Okay, I'm sorry, but I'm not even paying attention anymore. You want to look at reading and math and social skills and family relationships and obligations, chores, and responsibilities in my mind as if that child is typical. Because if you look at that child as typical and you don't accommodate their entire lifestyle to be special, they're going to be more likely to meet those gains, to meet those expectations. Okay? So, chores, responsibilities. I did an evaluation yesterday of a little girl that I hadn't seen in a long time. And one of the things that her mother told me was that she wanted to mature her. She wanted to help this little girl to be more with it, to be more like her peers. And she's a very typical little girl with Down syndrome. One of the first things that I'm recommending to that mother is that she increase the chores that this little girl is doing. I asked her, what chores do you do? And she said, well, I wash the windows, and I vacuum my room, and I dust my room, and I clean the bathroom. And I thought, well, that's, it actually was really good. I think she's about 10 years old. It was really good, actually. But I'd love to see her washing the dishes, taking the garbage out, polishing the furniture, helping to mop and sweep and cut the bushes and mow the lawn. And, all of those things sound absolutely crazy and scary. Well, sure. But with the proper supervision, this little girl can feel bigger and more grown up. And if she feels bigger and more grown up, then she's more mature. We have to be careful how we talk to these kids. We have to talk to them, get rid of the baby talk. And I noticed that just even with the teachers at school. I go in to visit my husband, and they see this little guy who's got CP, and, his brain works great, but, his body is a little bit, jeopardized. And they immediately raise their voice and talk slower. He can hear you fine, guys. It's just his body that doesn't work right. 4 months ago, I had a little young man, he's 19 years old now, but when I met him, he was 10. And he came to live with me because he wanted to move to Utah and go to school. And when he was 10, after his traumatic brain injury, Bob and I saw him several times, and I actually had the opportunity to do many of his evaluations. Hadn't really kept in touch with him, but he did have a huge crush on my daughter, Zoe. So they kept in touch on Facebook, and eventually they contacted me to see if Austin could move in with me, and he did. He's there at my house. And Austin got hit in the head with a baseball in his temple when he was 10, and spent like 2.5, 3 months in a coma, and the outcome was not supposed to be really good. And Austin now speaks Chinese, 3rd year. He, straight A student, all AP courses. He's going to Weber State University. He wants to go to China really bad, so if anybody has a house there and you guys want to help me get him there, that would be awesome. But he's a really cool kid, but Austin talks with a slur, and he doesn't have great mouth closure. And he also walks with his left leg a little bit turned outwards. So I bring him with me to work, and I take him all through the community, and I know a lot of people that own businesses in my area, and so I tell them, would you hire Austin? Austin needs to be a busboy here. Your busboy needs a day off because he's not doing a very good job. Austin's amazing. You've got to hire him. And they say, well, do you think he can do it? It's like, I don't know. Let me ask him in Chinese. He's way smarter than you guys think he is. Just because he slurs and he doesn't walk well doesn't mean there's anything wrong with his brain. The expectations of people tend to be low for kids with special needs, especially kids with Down syndrome, because they're visually different in most cases. Encourage people to have high expectations. Talk to your children as if they're a typical 9-year-old, 5-year-old, 15-year-old, 2-year-old. And continue to help them to grow by treating them more maturely. Input. Input is really, really important. With proper input, you get proper output. Meaning, I can't ask you what this word is if it says mom, if I haven't taught you that this word is mom. And how do I know when you know? Well, I have to have input that information enough times to know that you know. Okay? If you were going to teach me Spanish, which, by the way, I need to learn, I would really love to learn Spanish. I would need to have that information input to me enough. Because if you expect output, I'm either going to get it wrong or I'm going to guess. And if I guess, I'm going to be inputting the wrong information into my brain. So you need to input a little more, input a lot more before you try to get information out. So what does that really mean? Well, if I'm teaching my child numbers from 0 to 9, I'm going to input them 8 times a day from Monday through Thursday for a really short period of time because I don't want him to lose interest. Okay? So I'm talking like 8 times a day for 30 seconds. I'm going to input that information to him without expecting any output whatsoever, and I'm going to be the biggest spaz, happy, in-your-face, woohoo, inputter so that he doesn't fall asleep. Okay? And I'm going to input that information all the way till Thursday. And then on Thursday, when I get to one of the ones that made his eyes light up, like say number 5, when I get to number 5, I'm going to hold that number up to him and pause for a second. And guess what will happen? He'll probably spit out 5 by accident. And if he doesn't, I'm going to say 5. Okay? I'm going to input those with pauses, spaces, things that I think will help him to realize that it's his turn to say it. And a lot of times it just falls out of his face. Okay? So when you're doing input, check output. You can check it out by laying out 3 numbers and saying, okay, Jimmy, which one is 5? He'll look at it, touch it, pick it up, hit it, give it to me. By Thursday, I bet you anything he's going to know what number 5 is. And if he doesn't, then I need to change the way I'm inputting it, because I would expect him, if he's got good intensity, he's healthy, and he's paying attention, he should know number 5 by Thursday. Does that make sense? Okay, so this is a little guy in Matt's classroom, and doesn't have the best pencil grasp, but he's awful darn cute. Output really depends on input. Okay? You cannot get proper output without proper input. Processing. One of the things that Bob Doman taught me when I was working with him was sequential processing and its importance in development. It's really important. I know that because it's on every mental health assessment I've ever seen. It's done with speech therapy. It's done with behavioral therapy. It's tested in schools, in most of the cognitive testing. It's on a lot of the checklists. Okay? Processing is so important that it is on all those tests, but people, again, rarely tell you how to fix it. What do I mean by sequential processing? Does anybody know? Yes?
Like, for example, I think it's up till about age 8, a child should be able to do as many things as their age in a row and remember to do them. For example, if you're 2, you would say, go get the ball and bring it to mommy. That would be your process.
Very good.
Mm-hmm. For some reason, adults all fall off around 8 or 9, even though we should be able to do more.
Yeah, close. From my studies and the people that I've worked with in my years of working with people with processing issues, I find it's more about age 5. Okay? In the last couple of months, I was helping a fellow. He's an attorney in my town, and he was taking the bar exam in February, and was really kind of bummed out because he wasn't really learning well what he was studying, and he was really burned out. He had been studying way too hard too long. So that intensity kind of went down. And so I checked his auditory processing, and he's very, very successful. He was just taking the bar for Utah. He had lived in California prior, and very smart, on the ball, great guy. His sequential processing was at a 5. Okay? Like a 5-year-old. Some 5-year-olds, typical 5-year-olds, are at a 5. Well, so was he, but it doesn't have anything to do with his intelligence. He's a very smart man. But it's his ability to take in information and spit it back out. So we worked with him on his sequential processing, and I had him make audio tapes so he could hear things auditorily, all of the stuff that he was having a hard time with. We put it on a tape, he put it in his ear, we worked on his processing, and he passed the bar exam. And now in the state of Utah, I am the person that they send people who are having problems passing the bar exams. That's kind of an exciting thing. I only did it with one guy. We'll see what happens. It's really important. It does correlate a little bit with age. She's right. A 1-year-old can generally process one piece of information. Ball, cup, mom, eat, cookie. A 2-year-old, get ball, cookie please, those kinds of things. Okay, 2 pieces. As you get a little older, and with each child it's different, so I don't want you all sitting in here saying, well, my child's 3 and he should be processing 3 pieces. Oftentimes there is a little bit of a delay, especially in kids with Down syndrome. It is an important piece of something that you need to work on with these children and work on regularly, but I do caution you to not do it too frequently, meaning in the course of an hour, I don't want you doing it 10 times. There's something to be said, again, about intensity, okay? If I want to learn Spanish and I now sit with one of you at dinner tonight and for 45 minutes you drill me in Spanish, I'm probably going to lose my appetite, want to go to bed, and need ibuprofen in a bad way. Okay? Look at intensity. Look at what you're doing with your children and really, really focus on what's important. Yes, sequential processing is important, but one of the things that I've found in sequential processing in my research is that children with low sequential processing often have low maturity, and they don't have a whole lot of skills. As those skills increase, the processing increases, and the other way around. As the processing increases, the skills increase. I believe that they work together. Whereas in the past, I thought with low sequential processing, the skills would be low, and you couldn't make the skills higher without raising the sequential processing. In my caseload, that's incorrect. There's also a situation that I look at with the rate of processing. Again, the same mother I visited with yesterday and her daughter, she has problems keeping up in conversation with the rate of conversation. Okay, when people are talking, she might pick up a word or two, but she's not, especially with extraneous noise, which, by the way, I have an issue with too. So I get that. When you're looking at the rate of processing, there's things that you can do to help that. There's things out there like Fast Forward and a lot of other programs. You know, if you're working on getting a child to focus on, when you're working on rate of processing and teaching them to work within a conversation in a group of peers, you want to look at extraneous noise. Okay? Because one of the hardest things I'm having here right now is I have no hearing in this ear, a little hearing in this ear, but I can hear the guy back here for whatever reason so strongly that he's making me forget where I'm at. I'm losing my space and my place in my presentation. Because the tone in his voice is perfect as an irritant. Please don't ever tell him he irritated me because I have no idea who he is. But his voice is enough of a tone that's it's an irritant for me. Okay, it stops me in my tracks. You want to work on sequential processing probably with a little bit of a guidance, okay? There are some things that NACD has developed that I recommend to my clients. One is called Simply Smarter, which my husband actually had the ability to name. When we were with Bob, we were in the back of a limo, and he said, "Can somebody help me think of a name for this new software?" And my husband, Matt, did. Forgive me, Bob, for mentioning that. How do I go back? Does anybody know? The back arrow. Woohoo! Intensity and being a cheerleader. Okay? Intensity. Intensity is so important, you guys. All right? It's really important that you are not maybe so much loud and like firecracker in their face, but you don't want to do what I did before where it's 5 plus 8 is 13. Okay? You want to do whatever you can. Dance. Hang them upside down on a bar. Swing them on a swing. Blow bubbles. Clap your hands. Jump on a bed. Whatever you need to do to get that intensity up. Because if a child does not have proper intensity, you may as well not be teaching them anything. Because anything you put in is just going to fall out the other side. Be a cheerleader. Okay? Look at your response. I met with the little guy this morning, and I was talking with his mom about the importance of your response. So we're trying to get him to eat. Okay, that's one of the things we're going to be working on. And if every time that we put a little piece of food in and he and spits it out, which is probably what he's going to do as we're working on this, she kind of got a, okay? He's going to do that for the response. I'm not saying he's going to gag for the response, but if he likes it, and that's the response, and when he eats it normally, she just says, and gets him another spoon. He's going to work for the response. Our kids need feedback, guys. I need feedback. You know, if I cook, which doesn't happen a lot, I want somebody to say, that was the best chicken I've had. That makes me want to cook tomorrow. So we should call my husband. So if you're looking at intensity and being a cheerleader, look at your response. Are you giving them good feedback? Are you only responding to them when they're naughty and when they're doing something that's awful? Okay? This works with teenagers that are typical, by the way, also. Respond when they do the right thing and try not to respond when they're doing the wrong thing. You can change the brain, guys. I know, 3 times over. The little girl at the top, her name is Amelia. Okay? She's one of the kids that I've seen. I actually saw her a long time ago when she was teeny tiny. And they found me on Facebook, which can be a curse or a benefit. I don't really know yet. Still kind of playing with it. But they found me, and Amelia came to me in Utah. And she was, a long time ago when I first saw her, she was on the autism spectrum. Okay? Her doctor had given her parents the knowledge that, she would be in special ed forever, and it probably was her vaccinations and, all of this. And I just knew that Amelia was probably pretty food sensitive. Okay? And I am not a doctor. I really want to be. That's going to be what I do with the rest of my life, but I'm not. But I knew, just looking in this little girl's eyes, that doctor was probably wrong, and I was going to try to disprove him. So we worked. Her mom homeschooled her, pulled her out of school, homeschooled her siblings so that she didn't feel like she was any different, and worked with her. She did the same program that I wrote for her a long time ago with modifications, doing a lot of research and reading on her own. When Amelia came to me a month and a half ago, she was a pretty typical little girl. Amazing and wonderful. And I'm grateful. And her mother, I would hire her in a heartbeat. She knows her stuff. She gets it. It's logical. She followed everything that she read, that she checked with me. She did it all, and she did it right. And Amelia's lucky and smart. The one right below her is Artie. He's not looking at the camera. When I met him in November, he said, "Artie, and please." That was it. I work with him 4 hours a week. I'm fortunate, when I left NACD, I had a non-compete agreement, which meant that I couldn't work with children anywhere in the world in any capacity. And last November, I started back working with kids again, and I met with Artie. His parents had put an ad in the paper, and they wanted a teacher to come and work with them because Artie was 24 and he wanted to go to school. So I went and I started working with Artie, and he's the cutest thing. He wouldn't make any eye contact or anything. He was kind of embarrassed. But we sat and we worked, and I've taught him to read. He knows his numbers, his months. I have a real problem with him because any word I wrote on a note card, he'd read it before I got to flip it and flash it to him. It's like somebody else had taught him to read, and now it's just all coming back to him. He can decipher between they and them and there and two and two and two. This kid's brilliant. Just had to be pulled out of him. He's a little guy I told you about earlier that had that seizure. He was on some pretty heavy meds, and his parents had pulled back on those meds, and he's really kind of coming out. He does a lot of video speak. I bought him a bunch of videos that my husband had that were on, VCR tapes that nobody uses anymore, but they had a VCR, and we played those tapes, and Artie is now stopping the video speak because he's seeing a whole variety of new information. So he's talking more about what he saw today than what he's seen for the last 20 years. The little gal next to him in the leaves, her name is Jenna, and she came to Utah last month, and she's actually going to be moving there. Her mom's an RN, and she had divorced her husband, and she's moving to Utah, and she's going to be my assistant. I'm going to work with Jenna every day because I want to. She's a really cool little girl, also diagnosed with autism, in an ABA program where she's really no trouble at all. I mean, she doesn't have outbursts or behaviors or any issues whatsoever, and honestly, she gets forgotten. They work with her, do the same things all the time, that she meets her goals, it's no big deal, but I really think I can push her a whole lot further. So I'm going to work with Jenna every day. And we're going to see where we can take her. Her mom has really high expectations, so I'm excited to see what comes of her. And the little gal next to her lives in California. Her mom and I are friends and have been friends for a long time, and I get to see her periodically. She's got a syndrome that I don't even know the name of. I only have ever seen 2 children with her syndrome. She's a really neat kid, and one of the things we did with her was I got her to do bigger and better chores. Her parents, she's 11, and her parents were treating her like she was 3, and she was acting like she was 3. Yesterday, she baked a bundt cake gluten-free, by herself. She's a neat little girl. My role as a neurodevelopment is to talk with the parents. I determine the priorities that that parent has. Maybe it's speech, maybe it's mobility, maybe it's academics, maybe it's getting along with peers. I determine the priorities. The parent might have certain concerns, but I might see other things, like a child that's got high stims, getting lost in themselves, turning off. I might see an issue with mobility. They're trying to get him to walk when they really should be teaching him to crawl. They are trying to teach him to sit, but he can't creep or crawl yet. I might look at the priorities and talk with the parent and explain what I want them to do different. And the reason I do that is because if the parents don't believe me, and I just tell them what to do and they don't buy into it, A, they're not going to do it, and B, if they do, they're not going to do it right, or they're not going to do it at all. They're not going to do it right, they're not going to do it at all, they don't believe me, I'm done. I haven't helped that child. And I'm not going to sit in front of a child that I can't help and pretend I can. So if I'm there and I tell you, this is what I want you to do, it's more important to me that you buy into what I'm saying, that you believe in me and you have trust in me. And if you don't, challenge me. Tell me. What don't you believe? Do you need me to have you call a few parents? Do you want to see what I mean? Do you want to look at studies? Do you want me to show you on you how it feels? Do you want me to do it with your child? Do you want to talk to me every day after you do it to make sure you're doing it right? It needs to be done. Whatever we have to do to get it done and get it done right, that's what's important. I assess the child, I determine the priorities, I come up with a plan. The plan changes. I set the priorities again. I watch the plan in action, and I often reorganize those priorities because the child changes, the situation changes. It's now summer. The plan I put in place in September isn't going to work because now all the other kids are home from school. We've got to change the plan. I'm going to say some numbers. I want to check your guys' processing. Is anybody not game? Anybody not want to be picked on? Is your name Sue Mayer, by chance? You. I'm going to say some numbers. Do you want to do some jumping jacks? Are you ready? Aren't you glad I picked on you? I miss you, Sue. You ready? Say these numbers after me. 2, 7, 1, 5, 3. Woohoo! You got it! Okay, let's do another one. You ready? 8, 6, 1, 4, 3, 9. I am impressed. You've been working. Just kidding. We're doing sequential processing, okay? And what we want to do is we want to say numbers in monotone voice. So not sing-song, not 8, 6, 1. Okay, it's 8, 6, 1, 4, 3, 9, 2. Okay? Obviously, we're going to start low and work our way up. All right? We're going to do this sequential processing with a child with a high level of intensity, high frequency, low duration. Okay? Working on sequential processing is an important piece, but it's not the only piece, guys. Another thing that I'd like you guys to think about is looking at your professionals, looking at the people that are working with your child that have seen other children just like or very much like your child. Okay? The people that work with developmental disabilities, with issues, have seen lots of kids like yours, not exactly like yours, but try to get everybody to work together. Okay? From the teacher to the neighbor to the husband to the speech therapist to the OT to the PT to the ND, everyone needs to work together. And remember, you are the boss. Thank you.
Okay, we'll be starting in just 1 minute. How many of you filled out your thank you cards for Autism One? Oh, we got some rule followers here. This is good. This is good. Everybody know they're back there. That would be fantastic. Just going to make sure we've got the PowerPoint raring to go, and we'll get set.